Hello everyone, welcome to Fundamentals of Pharmacology, and I'm going to explain about the general classifications of drug with me, Miss Kinnan, as the team of Fundamental of Pharmacology for ETP 2025. So we're going to learn the highlights of the drug classifications, and then we are going to learn about the nursing considerations and drugs classification. So this drug classification is copyrighted by Dr. Manik, and I've asked her permission to explain it to you in this class. Now let's begin. So we have what we call chemotherapeutic agents. So chemotherapeutic agents consist of anti-infection drug, antibiotics, antiviral, antifungal, antiprotozoa, antihelminthics, and antineoplastics. So these are all the medications that you can see. You can take a look. If there are language in Indonesia that you do not understand, feel free to contact me, then I'll be happy to help you. So these are actually all the medications that contains as chemotherapeutic agents. Now we move on to the drugs that works in the immune system. So basically we have three types: anti-inflammation, immune modulator, and vaccines or Zera. So you have this type of medication as anti-inflammation. And then you have this interferon, interleukin, immunosuppressant, interleukin receptor antagonist, and antibody monoclonal as the immune modulator. Then in vaccine, because it's playing in your immune system, you have the vaccine. You have the vaccine coming from the bacteria, you have toxoid, and as well as vaccine for the virus. And you have immunosera, and you have antitoxin and antivenin. Now let's move on to the drugs that works in the central nervous system and peripheral nervous system. So we have what we call the agent anxiolytic and hypnotic, and antidepressant, psychotherapeutic, anti-epilepsy, anti-Parkinsonism, muscle relaxant, narcotic anti-migraine, anesthesia, local and general, and we have also neuromuscular junction blocking. So these are all the medication that we use to help with the central nervous system and peripheral. Now let's see the drugs that works in autonomy nervous system. So we have the agent adrenergic, the adrenergic blocking agent, and the cholinergic agent and anticholinergic agent. So you will be able to see this type of medication, and again we sometimes use this for the medication in anesthesia. Another type is the drugs that works in endocrine system. So we have the hypothalamus and pituitary agent, adrenocortical agent, thyroid and parathyroid agent, as well as antidiabetics. So as you can see here, there are the type of drugs that you probably will encounter them during your journey as nurses. And these are the drugs that works in reproductive system. You have the one that working in female reproductive system, the male reproductive system. So you have the estrogen for female and androgen for male, and these are them. Next, we have the drugs that work in cardiovascular system. So we have the drugs that affect the blood pressure. We have the cardiotonic agent, anti-arrhythmia, anti-angina, a lipid-lowering agent, and then the drugs that affect the blood coagulation, as well as the drugs for anemia. So you will see the erythropoietin will be here, vitamin B12, and also folic acid derivatives, as well as like aspirin and simvastatin and lidocaine, digoxin, and also amlodipine. So that will be the drugs that working in your cardiovascular system. Another one is the drugs that work in renal system. So we have the diuretic agent and also the drug that affect the urinary tract and bladder. So we have the thiazide diuretic, thiazide-like diuretics, loop diuretic, carbonic anhydrase inhibitor, potassium sparing diuretic, and osmotic diuretics, as well as we have the medicine that will help us when there is infection in the urinary tract and bladder, such as norfloxacin, flucloxacin, phenosodrizoin, and pentosan and doxazosin. So these are the drugs that will work in your renal system. And these are the drugs that will work in your respiratory system. So we divide it into two. The one that we commonly use and is commonly in the over-the-counter medicine, the drugs that affect your upper respiratory tract. So we have the antitussive, decongestant, antihistamine, expectorant, and mucolytic. And these are the one that we can buy over the counter. And we also have the drugs that works for your pulmonary obstructive disorders, such as bronchodilators, sympathomimetics, anticholinergics, steroid inhalation, and also leukotriene receptor antagonists and lung surfactants. So these are things that work in your respiratory system. Now move on to the digestive system. Here we learn about the drugs that affect your gastrointestinal secretion. So it will be the antasida, the proton pump inhibitor, antipeptic, prostaglandin, and also digestive enzyme. And you can also have laxative and antidiarrhea because it's very important into our digestive system. And we also have the emetic and antiemetics. So the antiemetics consist of this type of medication. Now, as nurses, what you need to consider when you are talking about drug classification. So you need to remember what's the drug action. So what's the pharmaceutic and pharmacokinetics as well as pharmacodynamics of the medicine. Then you have also to think about the cultural and the pharmacogenetic consideration. Consider the traditional health practice beliefs as well as the genetic background of your patient. And you also need to consider drug interaction, whether consuming this type of drug will then increase or decrease the other drugs. And also you have to think about the over-the-counter drugs, whether the usage of this drug then will interfere with the other prescribed medication. And you also have to think about the drugs of abuse. So for example, there is intoxication, detoxification, there probably will be the withdrawal syndrome, the cessation, and the maintenance of the abstinence. You as a nurse also needs to consider if your patient are very used to herbal therapies, as well as when you are handling pediatric patients, you have to always adjust the dose. You'll learn more in pediatric nursing about adjusting the pediatric dose, as well as what to do with the pediatric patients. And also, if you're handling geriatric patient, you'll also learn this in geriatric nursing in the future. But then you have to really consider that as the people as your patient aging, then there are a lot of consideration because the organ also suddenly and not suddenly but then also aging. And we also need to think about the medications in community setting. For example, if the patient is with tuberculosis, so we need to have like the person who is responsible to make sure that the drug has been taken, as well as the stigma. So for example, your patient is with HIV, so then they need to take medications, and how that then hinder them because of the judgment from the society, as well as the normal thing that you need to do as nurse. You need to play with ADPI, so always remember the nursing process during your patient care, as well as when you're giving medication. So you need to always assess, then diagnose properly, and then plan what to do, and then implement it, and then evaluate what you see in your patient. As well as when you are doing medication administration, you have to always maintain the safety and quality in your pharmacotherapy, which means you always remember the 6 rights. You then really paying attention for the safety risk that might able um, um, happen to you. For example, the needle stick injury, just because you're not paying attention on how to recap and not to recapping. And then you also have to pay attention about your high alert medications, as well as we learned this before, but look alike and sound alike medication. That's why you really need to do double check with the senior nurses or with another colleague in nursing, that you can then apply the safety and quality in pharmacotherapy very well. And the most important thing, once you're going to administer medication, you really need to have a very good drug calculation so that you are sure you're giving the medication with the right dose to the right patient. All right, so these are the consideration that you need to always think about. So you will have the drug definition. This is also what you do in your medication logs. So you have the drug definition, the generic name and patent name. You can have the image of the drug. You can have the drug class and classification, the indication and the contraindications, the side effect of the medicine, the pharmacodynamics and pharmacokinetics. Then you have the dosage and administration, the nursing consideration, the pregnancy safety index for the medicine, as well as the special precautions that you need to have once you're going to administer the medication to your patient. Well, that's the end of this first slide. So happy learning and thank you for listening.